Hello and welcome to Wellness Wednesday. Today we are going to talk about suicide prevention. Just to share a little bit about who I am, my name is Virginia Inge and I'm the Clinical Behavioral Health Administrator of the Mobile County Health Department Family Health Division. I'm also a licensed professional counselor. Primarily before starting, I want to share that I am not an expert on suicide prevention. However, I have spent a great amount of time studying this in addition to creating policy and revising policy for the Mobile County Health Department. Today, I'm primarily going to share with you some different standards and different ways to detect suicidal ideation in patients. The audience that I'm primarily looking to help and connect with today don't only include people that might need a little bit of hope, but also helping professionals. That may include nurses, doctors, social workers, behavioral health providers, medical assistants, really anybody in the helping profession. So, to start out, I want to share that why focus on healthcare settings? Why not just leave that to AltaPoint or to some of these other mental health entities? Some startling statistics have come out that 45% of people who commit suicide see a healthcare professional within 1 month that they made that decision. Almost all within a year of the date that they made that decision. It's very important to consider the risk factors that go along with suicide and suicide prevention. Unfortunately, another startling statistic, may I add that we're live right now, so if you have questions, feel free to ask me and I'll do the best I can. But in addition, 4% of the U.S. population have seriously considered suicide in the past year. Suicide is on the rise. With that said, not everyone who reports that they are having thoughts of wanting to harm themselves or take their own life actually plans to actually commit the suicide. So it is very important not to panic if someone does state that they're having suicidal ideation, but it is important to detect it. Here's a time where I want to share a little bit about how you can increase your awareness of suicide risk indicators. In many health care facilities, they administer something called the PHQ-9. This is a brief depression screening. On question 9, it basically states, do you have any thoughts of self-harm or of wanting to die? Obviously, if they score a positive on that question, that indicates that they are indeed having suicidal ideation. If they score a high number, being 20 or above, that also means that they are at heightened risk. If someone is in your office and communicating feelings of shame or disconnection, such as statements such as, I'm not worthy enough for love, or I'm not lovable, or I don't belong, that could also be a risk factor. I'm not going to name every risk factor, but it's definitely important to look out in case they are kind of withdrawn, sad, showing feelings of powerlessness, possibly even self-hatred, and particularly if they have a history of suicidal attempts. Other people that might be at heightened risk are people with psychiatric diagnosis, which include major depressive disorder, schizophrenia, bipolar, and eating disorders. Substance abuse and impulsive behavior are also risk factors. So the point is, get with your organization and really look to collaborate in revising and creating policy which addresses the detection of suicidal risk indicators. Per Joint Commission, which is a credentialing entity to help people like us and help organizations like us get further funding by being credentialed and showing proper care of patients, recently sent out an alert that covered suicidal ideation detection. So not only do you need to detect it, but you also need to screen it, doing a risk assessment, create a safety plan, connect that person to treatment, being behavioral health or counseling, and follow up. One common mistake that I've seen is we may immerse ourselves, and medical professionals might even really do the right thing in showing the hope and showing care for that person, but due to the busyness of this type of agency, follow-up can sometimes not happen. This is a big deal because when you already have someone that is feeling a great amount of distress and suffering, they're more likely and prone to negative thinking, and they're more likely to doubt your sincerity if you do not follow up. So follow-up is very important. When you're talking to a patient that has suicidal ideation, with that said, it's very important that you have the right contact information with them. Common mistakes, unfortunately, include people aren't screened, the right questions are not asked, a safety plan is not created, and people don't follow up. But someone might say, well, oftentimes patients just might be guarded and really not willing to share anything. A great way to do that is to have proper policy to where all patients complete a PHQ-9. In addition, people that complete this brief depression screening need to, you need to know that they can read. You need to make sure that it is done properly and appropriately. So here's a really good piece that is easy for me to talk about because I've done it and I've seen it work and I've seen it really create a safe space for people. Do not panic. So if someone expresses suicidal ideation, do not panic. Do not immediately get to the phone and get everybody in the hospital to come there. If you appear afraid, this actually increases emotional arousal of the individual. It can make them feel more alienated, alone, and you don't need to panic. So don't panic. Remain calm. You are a professional. Be present. So a great way to help someone feel safe is to be present and listen closely. A great way to show that you're actively listening is repeating back what you hear, maybe asking questions, showing curiosity into that person's life and into that person's symptoms of distress. Provide some hope. This is the final one because it is truly the best way you can prevent suicide from occurring. Many times people that have suicidal ideation and that commit suicide have lost hope, and they feel that it is an escape to leave and nobody would really care anyway. So promoting hope is a very, very powerful tool that you can do. A simple statement could help somebody, such as, "You've been through a lot and I see that strength." One thing that I remind people of is you're set apart. The fact that you've gotten out of bed and come in here and received the care that you need, that sets you apart. Another thing that can be very helpful is if you ask the patient to pull out their phone and put in the National Suicide Lifeline into their phone. This is much better than giving them a sheet of paper because oftentimes people lose that. So right now, I want to ask all viewers that are watching this, whether you're a mental health care professional or whether you're just somebody who cares and possibly someone who has experienced suicide within your family or your social circle, I encourage you to put this number in. The number to the National Suicide Lifeline is 1-800-273-8255. In addition, there is a crisis text line that you can simply text "Hey" and you will connect with a mental health professional. Both of these lines are on 24 hours a day. So especially if you're in counseling, that counselor might not be able to help you at 2 a.m. So suicidal ideation, you don't know when it's going to happen necessarily. So it's very, very helpful to have accessible mental health support. So the text crisis line is 741-741. Again, that's 741-741. A simple dialogue with a person can be such as, these numbers can be useful. And, the more you show your confidence and that this can be helpful for anybody. I mean, I've got the number in my phone. The more comfortable they will with putting it in their phone. And it can really help. So you might not be a therapist, but that doesn't mean that you can't create interaction that actually is therapeutic for the patient or for someone, your friend, whoever it is. It's super important to empathize. That means you don't pity them. You don't say, "Oh, you poor thing." You empathize. You meet them where they are. You become connected with them and you look to imagine the pain that they're going through. It's super important, particularly, and this is me providing the psychoeducation, but it is super important for you to understand that oftentimes it's a heightened degree of stress that can lead to suicidal ideation. So sometimes it's possible for a person to feel on fire. Their stress level might be 90 out of 100. When someone's stress level is that high, they're more likely to make decisions that they wouldn't normally make. That could include substance abuse. That could include such as binge drinking or drug abuse, and in worst cases, taking your own life. But it's important to remember that because you can help somebody de-escalate. Simply listening to them and them getting the impression that you truly are someone that cares about them will reduce symptoms of distress. So you are immediately in that moment helping that person by listening and by caring. Other things that you can share with them, so obviously you in that moment, but also who is your social support, and connecting them and saying sometimes just talking to somebody that loves you will help you reduce those symptoms of distress. A good night's sleep can also help. Sometimes just sleep it off. Even a 2-hour nap can help tremendously. It can reset your physiology. Taking a shower really helps reduce stress. So that is something good to keep in the back of your mind and know when you're helping people or when you're helping yourself. Placing your face in cold water, getting an ice pack and dabbing it on your neck or your wrists can extremely help. So these are little ways to basically share with someone. So we will be adding different links to resources. There are credible resources, including from SAMHSA and different entities like that have the most recent research, and we are happy to include those links. But a final just word of hope is we are all individual and we're all unique. No, not one of us is exactly the same. And you have no idea how helpful it can be if you simply show kindness. You don't know what somebody's going through. And I myself have had really dark times, and it's been someone in the parking lot saying hello and giving me a gentle smile that has changed my day. So you have no idea how much power you hold in simply the way you carry yourself and the way that you connect with other people. So I hope this was helpful. And again, if you have any questions, let me know. If you would like to ask a question during this segment, you can. Do we have any questions? No questions? Okay. Well, depending on the response to this video, we might revisit it and answer any questions. Feel free to message the Mobile County Health Department or myself with any questions that you may have. To set up an appointment with a counselor here, which can also help you stabilize, especially if you've been having suicidal ideation, you can reach us through the appointment line at 251-690-8889. In addition, you can reach the Behavioral Health Administration by calling 251-410-5772. Thank you so much for those of you who watched, and I hope you have a great Wellness Wednesday. Thank you.